Thank you for joining us today. Good morning. My name is Carol DeAndres, and I am the Stakeholder and Public Engagement Manager for the Master Plan for Aging team at the California Department of Aging. And we are pleased to be here with you for the Implementing the Master Plan for Aging Together in California, or IMPACT, IMPACT.
Oh,
Thank you. I believe, can you give me a thumbs up if you can hear me? Thank you. So as you can see, today we are meeting virtually and in person at the Cal HHS offices. And we really do thank agency staff for being so welcoming and helpful today. Thank you to our colleagues at Cal HHS. I'm going to go ahead and go over some logistics as everyone gets settled. So as you can see, we have live captioning available and ASL. Thank you, Rex, for joining us. Meeting slides, transcripts, and the recording will be posted to the Cal HHS website after this meeting. And committee members are mostly in the room. We do have a few online, and I believe we have all changed our name from the generic impact panelist to our actual name. How about next slide? So virtual meeting operations. The chat function is enabled for committee members, state staff, and our guests to share out supporting information, meeting related materials, information, resources, etc. And the public is able to view that information. The chat and the question and answer functions are not enabled for comments and questions from public attendees, but we do have a public comment period, and we invite the public to provide comments during that period. And at any time, you can furnish us your comments by emailing engage, ENGAGE, at aging.ca.gov. Next slide, please. So our public comment period, here's some guidelines. Attendees joining by phone, you can press *9 on your dial pad, and the moderator, myself, will unmute your line. And of course, via Zoom, you click the raised hand icon, and we will call on you and unmute your line. Do note you have 2 minutes for your public comment, just so we can ensure time for everyone. And again, should you have additional comments, please email us at engage@aging.ca.gov. Next slide. Okay, so we will turn it over. I am pleased to present Director DeMorris from the California Department of Aging to provide some opening remarks. Good morning, Susan.
good morning, Carol. Thank you. Thank you, everyone supporting the meeting, and to our team who made this possible. And welcome online and in person. It's great to see faces around the table. Today is a somber day. You know, just hours ago, a horrific plane crash and helicopter crash over the Potomac that, as a capital city, and knowing that so many of you make that trip to Reagan Airport often, it's just tragic what we're facing. And we know too that just a few weeks ago, the start of the Eaton and Palisades fires that still are not 100% contained, and the tragic loss of 29 lives in our state, many of them older adults and people with disabilities. And just 10 days ago, we transitioned to a new federal administration, and I know there's a lot of uncertainty about what's happening in Washington. So I just want to acknowledge what a heavy, heavy month January is for all of us, and to invite all of us to be very tender in our meeting. all carrying a lot personally and professionally this month. I'm so grateful to our foundation partners who allowed us to come together in October for the Day of Action. It was a very joyous day. We were celebrating many milestones. We were together in community and filled with hope and optimism. Welcome. So we carry that, that was a momentous day for all of us, really a high water mark for the Master Plan for Aging. And today is another milestone along the road. I reflect back as one of the original stakeholders. I never dreamed, and I'm an optimist, I never dreamed 4 years in that we would have an annual report that looked like today's. I thought it would be maybe two-sided. I never dreamed, and I'm a dreamer, that we would have so many results. And I also didn't imagine that we would have 81 new initiatives heading into our 5th year, that the work would just be so plentiful and keep redoubling every 2 years. So I'm so grateful that we could come together in October, that we can be together today, that we can mark this milestone and welcome our new members and returning members of the Impact Committee. Carol, were you going to show on the screen the agenda and member names before I introduce our featured presenter, our secretary? There we go.
Sorry.
So as a refresh, for everyone joining as a committee member, but also to our public members who are joining, thank you for being online. This is the committee purpose of the Implementing the Master Plan for Aging in California Together Stakeholder Committee. And on the next slide, you will see the official members of this group. There we go. And I think just about everyone is joining us today. And in today's 2-hour meeting, this is the agenda that we will be following. And it's now my pleasure to introduce to you more or less a new member of the committee, Secretary Johnson, who has twice been appointed by Governor Newsom. First, 5 years ago to serve as the director of the Department of Social Services. And in September of last year, Secretary Johnson was asked to serve over all of Health and Human Services Agency and to lead the Master Plan for Aging work in California. I can't think of anybody better suited for this time, coming out of social services, looking back at all of the things that, for those who don't know, with the huge department, 5,000 employees, give or take, supporting 7 million Californians. And we know some of the programs: in-home supportive services, residential care facilities for the elderly, HowFresh, Home Safe, HDAP, CCE, but also refugee support, border work, disaster shelters, SSI, SSP, the list is long. So Secretary Johnson's credentials, highly skilled, but your interpersonal, what you bring to this role, passion, your humility, your dogged persistence, we need you at this time, and we're here for you as you lead the Health and Human Services Agency, and not to forget her heroic work through the COVID pandemic and responding. I think that's what brings the cool head we need for these times, because you've been tested many, many times in your role. And like so many around the table, Secretary Johnson comes from the community. She has an advocacy background, a CBO background, local government, whole package. Excited you're here.
Appreciate that very much. And first and foremost, thank you all. I think Director's point, kind of where this has started, and not to be lost here as Kim McCoy waved to my left here. So many of us have been in this space since the beginning, and maybe various different hats and capacities. I think that just shows again both the commitment of this governor to make sure this work continues to be prominent priority, but also that our commitment in how we show up and work together is critical. So my first and foremost comment is just appreciation for each of you who have not only been the thought leaders in identifying what we need to do, but have also been our accountability partners to ensure we get it done, and being thoughtful about how we're planning for the future moving forward, given all that has just even happened in the month of January in 2025. So I just appreciate that we continue to be in this together, that our progress and our values remain steadfast in the work that we're doing, and it is necessary for our partnership to be realized in every step of the way, particularly in times as these that we're going through. So I want to first and foremost, yes, new to the role, but obviously not new to the California Health and Human Services Agency, but really recommit this work of the master plan and our 5 bold goals as priorities for this administration and for me in this role and capacity. And again, the invitation to continue to be leaders with us as we look to implement. I have spent more than half of January in Los Angeles and meeting with survivors, meeting with community-based organizations, meeting with government partners. And 2 things I will say that were my kind of objectives in every conversation I've had to date, and that is, 1, to really understand what we can do better and differently in response. How did the evacuation of older adults and those with disabilities, for example, work and not work? What can we be doing systemically differently to ensure that each and every time, unfortunately, these events are more frequent in California, how are we learning from each time and having a different level of preparedness coming into the next experience? So really leaning into, from the conversations I was having with skilled nursing facility operators and talking, just tell me how your process was, right? When there were many being evacuated in what, again, I'll just tell you from survivors' perspective, I don't know if any of you here had experience or other loved ones impacted by the fires, but the description is a blowtorch. Imagine a blowtorch. The speed at which this fire moved was so significant that the ability to have kind of contingency options A, B, C, D, E, F, because others were evacuating all together at the same time and within minutes, right? The need was so significant and severe. So it's again, not only learning about preparedness in terms of how we plan for these events, but the magnitude of the event really matters. And so we can't just think about the experience of fire in a less populated area, maybe with wind speed, just like the 100-mile-per-hour wind with embers falling right from the mountain. And so I just want you to know that's the lens by which, in whether it's the shelters that social services stands up in support of the county, or the evacuation of a SNF, right? We're trying to ask that question every step of the way so we can learn what we can do differently going forward. The second piece is obviously related to recovery. How is the state of California going to be the best partner and really address and support communities in rebuilding as fast as possible, and really understanding the history and difference of how people were situated who were impacted. And so how are we being very intentional about addressing people who are, whether that was a renter who may not have had insurance versus a homeowner versus someone who has the means to house themselves in a different opportunity differently, or who does not, right? And that's, again, the lens in which we're looking at recovery. So you might have also seen, well, I've been half the month there. I would say probably the governor's been there only maybe but a couple of days, right? He has been on the ground in Los Angeles through the course of this entire event, and really also doing the same kind of assessment and analysis of what is he hearing from survivors that's not the confusion. I want to know when I can go back home if I have one to go back home to. If I don't, I want to know how quickly and what my options are to be as close to the community that I can be, right? And be supported. So clearly, from the governor throughout the entire leadership of this state government, we are leaning into, again, learning on how to improve response, but also how we can be true partners in recovery, and we'll continue that work along the way. I will tell you, I want to thank you again because, right, Master Plan on Aging also points to things we should be thinking about in this space. We had a disaster guide that had been recently issued, and we're having these community conversations. So again, we are in real time taking these experiences and implementing what we have all together identified that we need to be doing differently. So it's not just about budget and what we can get in the funding and the budget. It's about how are we as an agency and partners in community utilizing the great work that's been put forward here in solutions that we need to be thinking about in all scenarios, and really embedding this in kind of like the how we do business, no matter what the experience is. So I just want to, again, appreciate your forward thinking that helps us be at a different level of readiness than I would say in the past. We still have more work to do, clearly. That's not lost. That's exactly why in these conversations, and again, I'm not the only one. The other Director Morris has been out in LA. Many have and will continue to be as we're supporting community and learning these different components. So we have the $2.5 billion investment. That's a good start. We know that, again, all resources combined, that the recovery is large, and we'll need to continue to assess, again, what the community needs to be supported. I also want to then turn more to the master plan and, again, recognize the 5 years in the making here and what's been accomplished, and want to just also lift up more specifically, just in the last year alone, some of the collective impact that we've made together, whether it be the Medi-Cal expansion to low-income Californians age 50 and older, which has been wildly successful, meaning the take-up is great and significant. That has been tremendous, again, in terms of supporting meeting the health needs. Records investments in training, stipend, and incentives. The workforce. How are we caring for the caregivers? Again, that's not lost on me in these times, as Director DeMora stated, right? How are we also giving ourselves grace as caregivers in some capacities? But what are we actually doing to invest in workforce, both in terms of retention of existing, upskilling like we did in IHSS and also in the direct care work, but also in recruiting new members of the workforce to be in this line of work and taking every opportunity to create those pipelines and make sure they're strong and that the quality of service as a result is impacted. Strategic investments in affordable senior and supportive housing. Director Morris mentioned community care expansion. That was one over at Social Services that we led, and you're starting to see, both in that particular example and others, the actual capital investments become realized. So new places are owned, ribbon cuttings are happening, and people are getting served, most importantly, in new and different ways that they have. Also, of course, making sure that existing capacity is sustained through things like the operating subsidies. And obviously, housing and homelessness continues to be a cornerstone. We have Director DeMorris and I both sit on the Interagency Council on Homelessness and have been re-upping, right? We know it's the fastest growing population. How are we being intentional about addressing the needs of this going forward? And that's been restated and recommitted to in our latest plan in that space. Again, I mentioned the Emergency Preparedness Guide, right on time. Couldn't, again, and that's also leaning into making sure we have language access, so important, and particularly in times of disaster, too, that people know how to keep themselves and their families safe, just simply by the messaging that's coming out. Do they understand that they need to evacuate? Do they understand that shelters are a place that they can access? Like, right, is the information accessible in languages of our California residents? And then I also want to note that for the first time in California's history, we conducted a quality of life survey for the LGBTQIA+ population, midlife and older adults, with having over more than 4,000 respondents in that example. So really, again, making sure we're informed by the voices of the people and lived experience and how that shapes our policy moving forward. So I have gone through the recommendations that were made at the Master Plan Aging Day of Action, both in the LTSS, the home care, preventing and ending older adult homelessness. And again, just want to recommit my absolute commitment to the priorities that you're putting forward here, again, in that capacity of both the co-chair of the Interagency Council on Homelessness, but also in this space as well. So it is a lot, and I think as it relates to particularly the changes that we're experiencing all at once, I want to also just say we have phenomenal expertise, we have alignment, we have different components that's going to make our ability to realize what you all have clearly articulated as our goals and priorities real. You hear my reaffirmed commitment. And so while I feel like the earth's moving beneath us from time to time here, and that's also intentional, we have the ways in which we're going to come together. We have plans. We can expect to know what's coming and be prepared for our ability to protect our progress and make more together. So I'm appreciative of those partnerships. I don't take that partnership for granted, whether it be those of us in this room, in this community, or the partnership with the legislature, right? We do have a different ability to be really thinking through how we're, again, protecting. I look forward to doing that in that space with you as well. So those are my comments to start with. Glad to be in it with you together. And I'm a California native and would not be anywhere else right now. So I am grateful to be in California each and every day, and especially now. So thank you all for what you're doing. Really appreciate it.
Very, very much. And we're going to just do a slight detour here. We thought we would have our senior advisor, Kim McCoy-Wade, offer her remarks, and then we'll open it up to question instead of the herky-jerky questions. And Pam, thank you for being here in person and for joining us.
Before I start, I want to introduce Chandani Battle, who is our Coro Fellow in the Governor's Office from Richmond, California, working on career pathways for people with intellectual disabilities. And today's her birthday. So she's
got a great gift.
We're going to feed her well today. But actually, it's wonderful in these tough times to be here with Secretary Johnson. We have been through many of these 10 years of traveling through CalFresh, CalWorks, through CDSS, through CaliHHS, to the Governor's Office. I think we're going to, there's been two major shocks to our system this month, if we can limit it to two, and thank you for all of what you have said about the fire, but even more what you've done. The experience with Anna Acton, with Christina, many people on this table, and working through many previous fires and disasters, and of course COVID. It made me feel, knowing you were there on the ground, and hearing the need to be better, and getting it done. I'm going to focus more on the other shock, which is the change, not just in the change in administration, that happened at the time. We've been through that. This is an entirely different change, as we all know. I do think it's extraordinary that the Master Plan for Aging seems to be right on the vanguard of highs and lows. The governor's first state of the state was calling for a master plan for aging. 6 months later, the executive order came out. I was privileged to be able to join CDA, and off we were running. We survived COVID with a short pause. One of the few initiatives that kept going through COVID. We released during a coup by violence, attempted coup by violence. We kept going. Here we are with man-made disasters, accidents, climate disasters, and an attempted coup by administrative efforts on Tuesday. So it's a lot, but the Master Plan for Aging, and certainly California, and certainly our governor, keeps going. I kind of wanted to share a little bit about how the governor and the administration is responding to this moment. I mean, first of all, and Secretary Johnson with Director DeMorris would echo this. I mean, the work in California continues. Whether it's the fire rebuild, whether it's the implementation of healthcare, whether it's the workforce development, jobs first, the Master Plan for Aging, the work absolutely. We, maybe more than ever, need to continue to build what a government that works for and with people, with fairness at its heart and compassion at its heart looks like. Second of all, we will protect California's values. We're not going to get into every little war of words, but certainly California's values will be protected. Fortunately, we have a long history of already doing that. We have protections for civil rights. We have protections against hate. We have protections for LGBTQ people, for people with disabilities. And so standing on that, leaning on that, and fighting for that. And then the third thing I think that everyone's touched on is we need to stay in community to get through this. This is something. A lot. Even this morning, those of you may be following, the president was blaming the accident on people with disabilities working at FAA, which is premature at best. We don't know yet what happened. So it's heavy. It's heavy. heavy, but we'll get through this with community and care. We all have different roles in this moment. We three have different roles. You keep have a different role. Christina, that's a different role. We'll change jobs every time. Sarah, of course. So those different roles, it's wonderful that we have that different perspective and that history, and we'll all be in different places to do different things. So to your point, there's too many things to highlight. You did a wonderful job, but I just want to kind of be concrete in terms of how we're protecting people. I do think the fire response shows what California can do as a state. We do need our federal partners, our OES, the funds that we're working on in partnership with the federal administration on, and really welcome your letter saying that that $2.5 billion needs to include a focus on some of the most vulnerable, both in the response and the recovery. So that was a very welcome partnership to hear from you all immediately and directly. And I also want to say, we know that there's so much more to do on housing and affordable housing, and we knew that before LA, we knew that before what's going to happen with the economy, and that continues to be a primary focus. And I think the best evidence of that is the governor proposing in the budget standalone housing agency. For a long time, 10 years ago, those of you 20 years ago, housing was kind of the sleepy part of business and consumer services. This to me actually is important, that finally we will have a standalone housing organization focused on housing and kind of reset. And I think it's a real opportunity for this community to say, where are we now with demographics and housing needs, and kind of challenge longstanding stereotypes or true trends about senior housing. It's much more large, complex, renters. And so I really encourage you to engage with the reset of the housing agency as an opportunity to really chart some new focus and new outcomes. I also want to say that California is protecting our democracy. One of the key things we have to do right now, and I just want to urge you to probably pay more attention to Attorney General Bonta's work than you normally have to do or want to do. But what he's doing to protect the Constitution with the other state attorney generals, that has enormous impact on elders. That birthright citizenship is part of our country, and that federal funding can't be paused by a memo. Those are core constitutional powers that are being protected. So stay tuned, particularly with our AG. I also just have to say to this audience, Californians are not afraid to take direct action, and particularly the disability community is no stranger to 504 protests and the history of that. So this is going to be a time, and Gray Panthers even way back in the day, Maggie Kuhn. So this is going to be a time for some creative, some smart, some strategic actions that maybe we haven't done for a few years. Although those of you who've been here for a minute remember Jody Reed and Karis. I roll in to our meeting, interrupted our meeting about a year or two ago, said we were not moving fast enough, doing enough on home care, and that master plan for aging that wasn't centered around care was not going to meet the needs of aging and disabled folks. And it was impactful. It was impressive. And so we continue to welcome that as needed, and in fact, are counting on it. And last of all, again, in some ways, it depends on where you sit, what your role is going to be, but building the different worlds, building what's possible, building a community of care. I continue to think that we are modeling Medicaid at home, if you will. Our former vice president called for Medicare at home if she were to be elected, and she was not. But the Medicaid home that's being built out, the DD services, the IHSS services, and now the CalAIM services, is really an opportunity to communicate clearly to this country. We can do it if we want to do it, and invest in it, invest in the workforce and the infrastructure. And I also think we can continue to lead on our biggest challenge, which is affordability. I appreciate very, very much the proposals that have come from the community around need to make healthcare more affordable, tackling share of cost. We need to make sure basic income keeps up with that dang FSP COLA. Many of us have worked on our entire careers in California. And although the January budget did not have new investments across the board, the conversation's just beginning. And there's so many variables, maybe more than I can't say more than ever. We've been through highly variable budget cycles.
We have been through highly variable.
Yeah. So let's keep our laser focus on what we can win, what we need to win for the people we serve. And with that, I just want to be in gratitude for the community. I know that I want to thank you for when you are publicly advocating. I want to thank you for when you are privately communicating. I want to thank you for when you were calling us in to do better, to do more. Appreciate when you don't call us out, because I think we have more to gain working together in different ways and creative ways than not at this moment, more than ever. So, and just personally, thank you for the support. This is tough. And so the more, thank you for opening us with grace. We all need that, and we'll be able to survive and thrive with that. Thank you. And happy to take any questions about.
Thank you. Yes. And so now let's open it up to Impact Committee members in the room, and then, of course, any Impact members who are joining us online. If you have any comments or questions for our secretary or senior advisor, while we have them. Anyone in the room want to start us off?
Well, I'll go.
All right. And please state your names for people joining online.
Yeah, I'm Eric Dowdy with the Alzheimer's Association. So I kind of want to go back to the fires, if we can, just for a moment. I know in the past there's been discussion of a statewide mutual aid system for facilities, housing, affordable senior housing, living, and skilled nursing facilities to all work through. Are we talking about anything like that in the context of what's happening in the South, or is there any other kind of method of kind of expediting evacuations that we're thinking about in a new way?
I'll definitely say that there are components of it, right, that exist today. So first thing that various, setting types, whether they be built in senior care settings or skilled nursing facilities do, we are trying to do that matchmaking for where we can for mutual aid. Thank you so much. Caring group, thank you. So again, using this example, and you might have seen this in the media, right? In a particular community, particularly in Altadena, where I've spent a lot of the time, right, there's actually a geographic area where several skilled nursing facilities sit on the same street. So when then that's a very different, right? So then, point being, quick evacuations to my earlier comments, and mutual aid with other like setting types was also exhausted quite quickly. Like, yes, we can do that. Then we also had the experience where the mutual aid setting was also needing to evacuate. And again, magnitude of scale. So I do think there is something to be thought through again in terms of how we are, I mean, this is where I was kind of trying to put a pin in. We do have processes, procedures, contingencies. These are all things that we have kind of evolved to do better at. Magnitude of the event and how quickly it was, I think, kind of made there needing to be much more. And I think then how we structure that and think through that when multiplied, right? You had Eaton Palisades, and I'm not been Hughes, thank you, together. So you actually have first responders deploy, I mean, right, again, magnitude. I'm just trying to give you a sense of kind of what was happening in real time. And so I think that does warrant another conversation then about how we are thinking through what to do when the magnitude is much greater than maybe our initial set of tools and resources yield. So I think it's a great thing to come back to where we are, which is always true in disaster, and to the director's point, unfortunately, right? And fortunately, I have had disaster under my purview in some shape or form for the full time of being here for the last 10 years. So you do get better at it, it's true. I think that we're right in the space right now of, as you heard me say, a real significant priority on recovery and helping community, but we can't lose too much the two things I was looking for, what we need to do in terms of understanding what occurred and response that needs to change. So I think we're right at the point where we were just actually having a conversation of how we're going to organize our kind of debrief of response and kind of really hear from others in terms of what informs our ability to shape new systems. So I appreciate you lifting it up. I think the magnitude is significant.
And I just want to build a little bit on addition. I know your question was about people who are living in licensed residences, but of course that's a small minority of older adults.
Yeah.
And the growing number of live alone older adults. And how is evacuation planning built into their independent living?
Right.
And so I think we've been having very ad hoc conversations that would welcome proposals about for example, could Meals on Wheels include emergency planning in their work? Could IHSS? I mean, these are all just blue skying, but those are the stories of, those people are trying to call 911 in this magnitude is not coming in time. And so how do we normalize evacuation planning that is effective for people who are also live alone?
And then how do we also accelerate solutions on housing? So, right, one of my very first things in going to shelters is seeing who's there. Who is there? And again, the population of the shelters that we've had was as high as 1,400 at the Community Convention Center at one time. You can imagine, and that was a lot when a lot of those settings that I just referenced had to utilize the shelter for any capacity because they just didn't have other options that were immediately accessible. So I think there were, we developed relationships with those in the shelters, and there's a really robust, I want to just tell you from the behavioral health side, I'm extremely impressed at every single place, and that's a lot, that I've been to in the 2 weeks that I've spent in LA, had on-site accessible behavioral health for a continuum, right? Crisis counseling, just like, come sit with me for a little bit. And that's LA County Mental Health, it's some of the healthcare partners, it's others who have been on-site at the Disaster Recovery Center, at the shelter, at the youth program, again, at every place that I encountered. So that's really helpful and shows us that we are moving, because that wasn't always the case. I can tell you that even in my 10 years, that's not always been the case that we've had that accessible behavioral health services. But when I see particularly older adults or those with disabilities, and two things I want to just lift up, right? We have what are called Fast Invest members. Please just give me a little bit of grace, and I can't tell you exactly what that stands for.
Look it up. Services.
There you go.
Honest on my back. But they're essentially going from person to person in the shelters to address access and functional needs, right? My glasses, everything from that to I don't have the whole range. And I spent time with them in the last time that I've been there, just to hear the kinds of needs that were coming up, and again, how quick were we able to respond to those. But again, what is the population there? And so, for example, I met a very wonderful resident who was 101. And my very first immediate question is, why is she here? What was her circumstance that we can't, again, quickly identify? Because shelters are great on the temporary. It's a life-saving mitigation strategy, and we want to get people moving out into better circumstances. So that's something that I think is real, that we have to continue to think through, or even how we're doing sheltering and support for that population, and how quickly we get access to other kind of more appropriate, right? We always look at the ADA showers and all of the things that go along with these structurally, but actually how do we get people moving out who need some more support sooner? So that's just another reflection that I have as I'm going.
Good morning, good to see you guys. Christina Mills from NOW, the California Association of Area Agencies on Aging. Just want to add a couple comments and thoughts based on the conversations my membership has had, as well as conversations that ACL invited us to participate in last week. C4A is we're working on putting together some educational listening sessions on this topic, so more to come on that. But a couple of things that really have stood out that are not new to me as somebody who worked in the disability space for most of my career. The AAAs have had a really difficult time, and actually not just AAAs. On the ACL call, it was very, very obvious that all of the aging organizations within Los Angeles that wanted to gain access to shelters to be first responders and help get people out of the shelter situations into other more permanent or short-term, better situations than the shelters, were not able to do so. And I know that that's something that in independent living we have faced for many years in figuring out how do we get independent living center staff into shelters. The same thing is happening to AAAs now, as well as other aging organizations. And, as service providers, those folks know exactly what consumers need. They need access into the shelters to be able to provide that. The second thing that I'm hearing that has, again, been something we've heard for decades is that shelters are not prepared to take older adults and people with disabilities. So we had lots of folks that didn't have, as you know, Secretary, folks that didn't have incontinence supplies, folks that didn't have places to put their medication that needed to be refrigerated, accessible cots, accessible restrooms, accessible showers, just some of the basics what I consider basics, continue to be missed when shelters are stood up. And these are all different types of shelters, and I won't even touch the churches because I know that they're doing it out of the goodness of their hearts, and people don't understand the difference between a church shelter and a Red Cross shelter and a public shelter. That's a systematic issue in its own. But the shelters that we can hold more accountable need to be held accountable for that type of accessibility. It's coming up over and over again. And I'm really glad to hear about, the administration wanting to have a department specifically for housing, because one of the things I've definitely been thinking about is over the years, housing is typically absent in all of these recovery conversations and disaster preparedness conversations. And I don't know if you read my recent blog, but just on a personal note, I asked my grandmother, who lives in an older adult disabled complex, what will you do? She's on the 3rd floor of a complex. What will you do when there's a fire in the building? Said, I'm going to get in bed and put the covers over my head because, like it or not, I'm not going to be fast enough to get down and get out. So I'm going to die one way or the other. And it made me think, how are we holding public housing accountable to ensuring that there's training and that there's a plan? She's in a low-income complex where we could easily be preparing people better than my grandma saying she's getting in bed with a blanket. Thank you.
I'll just add, I just want to thank C4A and especially Dr. Laura Trejo, who's a phenomenal leader in LA County. She brought together about 30 individuals and organizations, county government, health, human services, health plans, housing, housing agency, transportation earlier this week for a very productive and constructive conversation. To hear from every angle that collaboration and commitment, I just want to applaud Dr. Trey.
And a second, I'd say the folks, the ombuds down there, Molly Davies and Wise and Healthy Aging and her whole team.
Yes, absolutely. Okay, we'll take care.
I'm
And
going to
then
jump
Marty?
right in
Yes.
after this amazing being,
Uh-huh.
who I've known for many years, Anna as well. We've been through this. And
Please
we
share
understand.
your organization and your geography because
Yes,
Yeah.
organization. My name is Carolyn Nava. I am with the Disability Action Center, which is one of our California Centers for Independent Living. We are in our 45th year of community service, so we've been through it. And we've tracked behind situation after situation after situation. We were at the table with these amazing individuals when we started the Battery Assistance Program. We were the first center to say, we're out there, boots on the ground, bringing power, temporary power to people. The massive results of something like what is happening in LA right now, this is a generational impact. It really, truly is a generational impact. 2018 was the Camp Fire. I can tell you to this day, our highest individual served out of our center is a 50-plus-year-old white female with a disability who is still unsheltered because they could not afford to rehouse post-Camp Fire. This is a real issue. This is compounded now by multiple fires, including LA. My heart and mind cannot even wrap around what is facing those communities. The state, the federal, what we came to realize is it's not enough our local level planning. It's never going to be enough unless we have a systemic change. Why do we voice that? Number one, as Christina just voiced, after the Camp Fire, the Park Fire, the Car Fire, as a Center for Independent Living, we still require to fight our way into
the proposed increase in grant funding. Is it also rational to ask for an increase in the threshold to qualify as an organized or an established organization?
Pardon me, I'm not sure where that came from.
It wasn't me.
I think the ASL is switching.
So, you know, our heart really, I sit at this table my first time here and I'm opening my mouth already. Maybe it's and I was late, right? So here I am. Just the magnitude of what we are facing in recovery. Yes, we're helping our region, Butte County, Tehama County, we sent over 1,000 troops down, boots on the ground, to help because the experience of fighting these major fires. So our troops just came back after 2 weeks down there and said, oh my goodness, major problems, no water to even fight the fire, all of that. And they're doing the same as you are doing, taking this knowledge and saying, how do we make it different? How do we improve? Because improvement is always the constant in the mix. That voice, it gets followed by the next logical thing, which is housing. There is none. And we all know that. We realize, number one, that unless things began to change from the top of the chain, i.e. federal, we understand the battle, we're ready with our wheelchair and flags, right? But we understand that when you have a nation that is designed to provide emergency services to the able-bodied first, literally, they are taught by law, go into the community, find the capable, find those who can get out on their own as quickly as possible, move them out, then go back if you can for everyone else. That resulted in 85 deaths in Butte County. Because, like you said, that fire came in so fast. 100-mile-an-hour winds, nobody stands a chance. And it's not just the deaths on site. Understand we've been tracking this for a decade now, and there are still people that have died from the repercussions of the fire. Those with disabilities now with new respiratory conditions that no longer can breathe on their own, who already had health complications. So again, the magnitude, we respect everything that's being done here. We just want to say, as a Center for Independent Living, we are raising our voice high, mighty, loud. Our master plan for Aging Advisory Committee, 4 counties strong. We are ready to fight this and really understand how to make change that impacts our state and our nation. We'd rather lead the pack than follow somebody else's rules that just don't cut it. That's it.
We'll hear from Rafi, and then I think Dr. Young, did you have a question online? Okay, wonderful.
So, good morning, everyone. Rafi Nazarians from AARP, from Los Angeles, Angelino, raised in Los Angeles. Live a stone's throw away from Altadena, and my office is right there. Yeah. So this is very close to me, and obviously devastating to watch, not just Altadena, but the Palisades, Hughes, Hearst, you know, Hollywood. I mean, I probably can't even name all of them, right? And thankfully, a lot of them were put out pretty quickly. So it's been really heartening to see the whole of state response. But I do really want to raise the issue of housing. I really appreciate, Kim, what you mentioned, and Secretary, what you talked about. But this is going to be crucial in Los Angeles because we're talking about you know, generations of families who've lost their homes. In Altadena alone, there was 3 generations who lived 3 or 4 blocks apart. You know, all 3 homes on, and I know that they had a really hard time trying to get the older adult to leave her home because, you know, this was her, you know, one of her biggest accomplishments, you know, that she was able to, you know, get this home, to raise her family there, and so on and so forth. You know, it brings up the issue of housing, it brings up the issue of insurance. So there's just so many different issues that come up. So I would really, you know, say we need to really look at housing. We really need to look at, and I know the state's been doing a lot on housing the last several years, but we need to make sure that the locals also come along here because this is going to be a really long slog. But there's just so many people, you know. I know I can't think of anyone I know in Los Angeles who doesn't know at least one person who was personally impacted by this, if not multiple people. So just really want to raise those issues, and hope that, you know, that plays into the calculus, moving forward. I know at AARP, you know, we put together a resource card for our members in the area. Our foundation did a fundraising drive, and we did a match, $500,000, and it was really heartening to see the number of people who contributed. But we're going to need all hands on deck here, and I'm glad to hear what you're saying. But just wanted to raise those couple of issues up for you.
Yeah. And I'll just also say, just to, again, disaster protocol, right? Right now, you should know that local, state, and federal partners are physically embedded together at something called the Joint Field Office, and they will continue to be for the foreseeable future. And then we also, in terms of our recovery, are doing that with city and county. So, and to the extent that as they get situated and are going to participate, that'll be another opportunity there as well. So your point is well taken, right? And that's the piece also in disaster, right? I think point made there, it's a local response. The mutual aid in that case works when locals are overwhelmed. They put in a request for support from the state. State gets overwhelmed, right? And so again, it is a partnership that has to be realized, especially as it relates to housing pieces, because there are also different resources available. So completely appreciate that and want you to all know that we are embedded together, particularly with the city and county in the recovery.
And I just want to piggyback on that and lift up, you know, the housing expertise that this group increasingly brings to Master Plan for Aging. You know, last year, Leading Age and others had a victory of increasing the percent of tax credits for affordable housing from 15 to 20% for older adults. They brought us the bill 2 years ago. The governor said, not me, that's the Tax Credit Commission. Go there. They did, and they won. And so that sets us up so when those credits go, more of them will go to senior housing. So that real savvy about where the state levers are to help direct to the role, again, that Governor Newsom really has created. There wasn't a state role in local housing, is really important, and I'm grateful for all your advice and perseverance.
We'll take our final question for this segment from Dr. Young.
Thank you so much, Susan. I'm really honored to be here as a new member of the committee. I'm a professor at the Betty Irene Moore School of Nursing at UC Davis, and I also serve on the board of directors of the Archstone Foundation, a partner with the Master Plan on Aging. I really appreciate so much the vision and the tenacity and the commitment of Secretary Johnson, Senior Advisor McCoy-Wade, and Director Damaris. Thank you for all you've said today. I specifically wanted to just mention how much I appreciate your affirmation of our commitment to all Californians and to democracy. And I want to specifically say that we stand with you in our commitment to the equity goals that were so thoughtfully put together within the Master Plan on Aging. And we want to work with you and eager to make sure that those strategies that were identified continue their forward momentum. So that's something that we just wanted to officially mention to you. Secondly, my other comment is a little more minor, especially in light of all the things that we've been discussing so far. But as a new member to the committee, I had a little difficulty pulling a bead line between previous recommendations of the committee to and where they end up. And I think it's important for us to be able to track the progress and understand, in particular, when there are initiatives that are successful, the extent to which that addresses the issue and the extent to which there still remain unmet needs. And that would help me as a committee member to have a better understanding of that. So I appreciate that's a complex request, and the data tracking and understanding that is very difficult. But I think it's something that would be very useful and helpful. Thank you so much.
If I can just speak to both really quickly. So yes, I mean, the work that California does to advance its values continues. Nothing has changed. Nothing has been pulled back. Nothing has come down off websites. The work continues and will continue. So thank you for that partnership. And Dr. Young, Heather, the governor's office has the same question, as we're going to be halfway through our 2030 marathon, and the governor will be passing the baton here in 2026. What have we done? What have we left undone that's for the next person? So that's something we're all very focused on, is getting that kind of mid-decade, picture in a manageable way, but a useful way. How can we use that data for action? And thank you for your leadership in making that possible.
Well, thank you all for your comments and questions, and please stay as long as you'd like. And we understand you have many competing priorities on your calendar today, so we just appreciate so much that you're here.
And I do have to go, but the part I like the most is hearing from you all. So I will circle back to get that readout on your feedback on this. Thank you very much.
You got it. Thanks for being here today. Happy birthday.
Happy birthday.
Thanks for having me.
Make sure you
Thanks for the wishes. Yeah.
Oh, I know.
All right, so now we are moving to the segment of our agenda. I'm so pleased to have Sarah Steenhausen, our Deputy Director of Policy, Research, and Equity, Dupree, walk us through the MPA annual report and our new round of initiatives. Sarah, we will turn it over to you.
Sure. Sounds great. Well, thank you so much, and thank you all for being here. It's really great to be here with everybody in person. And I want to just spend a few minutes walking through our Master Plan for Aging annual report. You all have a copy of it in your bags, but then most importantly, focusing on the new initiatives and the key themes that are driving it, because we want to leave the bulk of the time to hear from you and your feedback for us. So it's wonderful to see all of our returning members and our new members, and just appreciate the opportunity to engage with you. So as we said, we're going to be walking through our annual report, which is organized by goals and theme areas. So I'm just going to quickly, next slide please, talk through some of the high-level accomplishments. We're really proud of the progress in Goal 1, expanding housing for all ages and stages. Recognizing, as you all have said repeatedly, and keep it front and center for us, we still have a long ways to go. That being said, as Kim mentioned, we've made some great progress in expanding affordable housing through the expansion of the goal from 15 to 20% in the low-income housing tax credit. We're really pleased with all of the progress of the community care expansion program, as well as the Home Safe program and the HDAP program that have served people who are at risk of or currently homelessness or currently experiencing homelessness. Huge milestone achieved when the Department of Healthcare Services was able to work with the Center for Medicare and Medicaid Services to get approval for transitional rent support through the BH Connect program. And then finally, really important work that happened with the California Office of Emergency Services, the Department of Aging, Department of Rehabilitation, to develop our emergency response and preparedness toolkit for older adults and people with disabilities. Next slide. In the area of Health Reimagined, again, just really recommitting the importance of the CalAIM program in helping ensure that we have a whole person-centered system of care. The CalAIM program, through the past cited program, has provided approximately $147 million in grants to 133 CBOs to build their capacity to provide enhanced care management and community support. The data that we have from last year shows that approximately 18,000 people over the age of 65 received enhanced care management, 30,000 received community supports, which is approximately 23% of the population. We know that more can be done. We think there's a lot of work to do to continue building out that program, but it's a great step forward. Additionally, we're really proud of the work to really transform our behavioral health system with the implementation of Proposition 1 that provides new money, $6.4 billion for supportive housing and services, as well as opportunities that we'll see through the implementation of Behavioral Health Services Act to expand opportunities for older adult behavioral health, and we'll talk a bit about that in our new initiatives. Also want to just say, in terms of the importance of community living options, Anna Acton, when she was at the Department of Rehabilitation, launched the Community Living Fund, which really has been a tremendous tool to support the one-time needs of people who are either at risk of institutionalization or who are trying to transition back to the community, but have really critical one-time needs. It could be for, you know, an air conditioner that they need in the home, or a ramp, or anything to help them stay at home or transition to the community. These are not sometimes very different needs that people have for their own services. So I'm really excited to see that since that program was launched a few years ago, 1,400 people have been served. So those are the types of initiatives that we're so proud of, and we hope that we can continue to push forward. Next slide. In the area of inclusion and equity, we were, as Secretary Johnson discussed, really proud of the release of our LGBTQIA older adult survey, the first one, and it provides a starting point from our understanding of the population needs and what we might need to do to address those needs. We're proud of the work to launch some of our older adult behavioral health initiatives, including the replication of promising evidence-based programs such as PEARLS and AgeWise, and the expansion of the Friendship Line to 7 threshold languages, and it served approximately 118,000 calls in last year. And then we've had tremendous progress through the ARPA investments at closing the digital divide. Through that initiative, we were very, very pleased that approximately, well, thousands of people have been served, about 73,000. And through the evaluation of that initiative, we saw a reduction in loneliness and isolation of older adults and people with disabilities. Slide, please. And of course, caregiving that works. Some really, really important successes with the implementation of both the Cal Grows Workforce Training Initiative and the IHSS Career Pathways Program. Cal Grows provided training, stipend, and incentives to the non-IHSS direct care workforce, as well as family caregivers. We were able to train through our community partners approximately 34,000 people, and we distributed $34 million in incentive payments to that population. The IHSS Career Pathways Program supported 58,000 people in their training, as well as $41 million paid out in incentives. What's important is that we are working on sustainability to ensure that the trainings that were developed through those programs can continue to be available free of charge to the population. So that's something we have on our website. We have a link to the resources on our slide deck as well. Next slide. And then finally, with affording aging, as was referenced, we were really proud of the 9.2% increase in the SSI-SSP income level last year, as well as real successes that we're seeing with programs such as Cal Able and Cal Savers to expand access to retirement savings, but also to tax incentives for savings for older adults and people with disabilities who have functional needs and need to have their LTSS needs covered through the Cal Able program. And then, of course, investments in nutrition infrastructure, $31 million going out to our community partners to improve the delivery and access to home and community meals, and ongoing work in health education and meal provision at the local level. Next slide. So with that, now I'm going to start talking through our initiatives. As Director DeMorris mentioned, we have 81 new initiatives, that many of which build on the work that has taken place to date, but there's also some new areas of work where we organize our, by goals and by themes. But really, we started with all of the recommendations that came from our stakeholder advisory committees. And over the past few months, we've been working closely with our state partners, recognizing that, many factors weigh into what we're able to advance over the next few years, but you all play a critical role in holding us accountable and helping push the envelope with where we can continue to go to make progress. Next slide. So with that, I wanted to just kind of underscore the importance of the planning principles that were front and center to us as we developed the master plan. First, the importance of delivering outcomes that advance the master plan for aging. Second, of course, protecting federal support for older adults, people with disabilities, and caregivers. That's front and center right now for us. Elevating underserved and underrepresented populations and communities, really underscoring equity in everything we do, and that's something we are continuing and doubling down with. Leveraging public and private partnerships. You know, this really is a whole of government, whole of society approach, and there are a few initiatives that we've elevated that are actually being implemented in partnership with our private sector partners. Finally, the importance of utilizing data to inform policy, programs, and services, and that kind of gets to what you were saying, Dr. Young, about the importance of our being able to measure our progress, but also measure what we need to do to close the gaps and get to where we need to be. And then finally, driving innovation for system change. Recognizing all of that and all of the different feedback that we've heard from all of you, we want to just reorient everyone that so much of what we do across the 5 core goals is really focused on these 4 areas of system change. Navigation, making sure that people can access services in a much more streamlined fashion, and that's where the no wrong door system efforts come into place. And then if we are better at helping people navigate systems, we have to make sure that there are the services available for people to access. So really understanding where the gaps are and building out a roadmap to ensure that by 2030, people can access services no matter where they live or what their needs are. Third is workforce, of course, supporting our direct care workforce, both paid direct care workers and unpaid, whether it be through growing the pipeline or providing training and incentives. And then finally, the big issue of how we're going to finance our long-term services and support system so that people can avoid impoverishment and don't have to rely on broken systems to fund their LTSS needs. So with all of that, you're going to see these principles of these buckets reflected in the new initiative. So with that, what I really want to just point to the important recommendations you have provided. These are big goals that we need to achieve, and we recognize we still have a ways to go. So we've heard you loud and clear about the importance of addressing the LTSS financing crisis, building a home care system that works for everyone, and of course, preventing and ending the crisis of older adult homelessness. So with that, I'm just going to kind of cover a few of the highlights and then want to hear from all of you. In Goal 1, we really have focused on trying to create and preserve housing options. So, for example, wanting to look at how we can continue to advance programs like the CCE program, Home Safe, and HDAP as well. Those have been tremendously successful in meeting the needs of this population. How can we look at elevating and lifting up some of the promising programs such as shared housing models and rental support for older adults and people with disabilities? And of course, we're really excited to be implementing the transitional rent program through BH Connect. Importance of at the local level, ensuring that the continuums of care are well connected with and trained with our area agencies on aging, the independent living centers, the aging and disability resource connections, as well as the health plans and the other social services available to people at the local level. Because oftentimes people don't even realize that they are able to access services, whether it's through housing supports in CalAIM or other services. We need to make sure all of our local providers are prepared to work together and understand how they can partner. And then also, we're really proud that we have some new transportation initiatives. Our Disability and Aging Community Living Advisory Committee has been very, very effective in elevating the needs for affordable, accessible transportation. So we have opportunities to elevate the California Transportation Commission's needs assessment to expand and improve access to accessible transportation. To include recommendations in the Transit Transformation Task Force report to improve the provision and governance of accessible transportation services. And then finally, to improve transportation navigation for older adults and people with disabilities. working with the California State Transportation Agency to streamline eligibility processes, facilitate easier access to benefits through the California Integrated Transportation Project. So I think we have a lot of work that ahead of us to focus in on transportation. And then finally, and so timely, you'll see a number of different initiatives aimed at really strengthening emergency preparedness and climate change resiliency, including the Emergency Medical Services Authority is going to be holding some listening sessions with older adults and people with disabilities to inform the design of the system, kind of to what has been we heard from so many of you now. I think that's an opportunity to think through what kind of innovations can be built in to the EMSA that meet the needs of this population. Research and evaluating approaches to support and disaster resiliency for older adults and people with disability. This is something that Cal OES and the California Health and Human Services Agency are committed to working on together. And then also really focusing in on activating our priority populations task force during the times of emergencies. Susan sits on the priority population task force. This is a really important effort that's chaired by both the Governor's Office of Emergency Services and Cal HHS, and it provides an important opportunity to coordinate resources and to really identify the needs of these priority populations. And then finally, tracking climate change and what the impact is on older adults and people with disabilities. So together, the Department of Public Health and the California Natural Resources Agency are going to be working on this analysis and then promoting resources for both the prevention and response during times of emergency. Okay. In the area of Health Reimagined, we are really looking forward to releasing the Home and Community-Based Services statewide gap analysis. This is something that's a two-part analysis that Department of Healthcare Services has led on the Medi-Cal side, and Department of Aging has led on the non-Medi-Cal side, where together, to this point of data and recognizing need, we really need to understand where the gaps are in the system. And so that will be these gap analyses. Many of you have provided significant input. We will be releasing them in the late spring. And from that, the most important part is taking the gap analysis and then saying, well, what do we need to do to build out a roadmap to improve access to the services to fill those gaps? So Department of Healthcare Services will be releasing their roadmap. And then we will be working with our state partners internally and releasing it by the end of 2026. So that will be really critical. We're also really doubled down on trying to advance the needs of addressing older adult behavioral health, particularly focused on loneliness and isolation. What a tremendous opportunity we have with Proposition 1. You'll see in the initiative says at the state level, we're going to be working with CDPH on ensuring that there are population-based prevention approaches to addressing older adult isolation and loneliness. It is a significant issue facing so many people as they age, and we need to do better to meet them and make sure that they are part of resilient communities. And then with the Department of Healthcare Access and Information, they're doing a lot to build out the workforce needs of our behavioral health population. So we're excited to work with them and expand some opportunities for older adult behavioral health workforce needs. And then also working with our local partners. Our aging and disability networks play a very important role in elevating and advocating for the needs of behavioral health. So we're going to be developing a toolkit to educate how our local partners can work to get the county level to advance and invest in older adult behavioral health. And then finally, we're going to be working towards developing dementia-capable systems of care by looking at new approaches such as those through community health workers and other work that was started by our CalCompass program as well. Next slide. In the area of inclusion and equity, not isolation, this is where we are super excited because we have committed to developing and launching an aging and disability no wrong door system. For those of you who were at the Day of Action, we heard loud and clear from the consumer panel of the importance of ensuring that we have a much more navigable system. And so this is something that we have been working with our No Wrong Door State Leadership Council, with Department of Healthcare Services, Department of Social Services, Department of Developmental Services, and Department of Rehab to design a much more person-centered both web portal and contact center for people to be able to access. And then, of course, important efforts underway to transform and future-ready our aging network through the area agencies on aging with implementation of SB 1249. We have work underway with Labor and Workforce Development Agency and the California Community College Chancellor's Office to do a state analysis of older adult employment opportunities and barriers, and then piloting some promising programs at how we can expand opportunities for older adults to remain engaged and employed. A number of important efforts also to align aging and disability, where we're developing community of practice with across aging and developmental disability and disability to make sure that these communities are aware of and working together in how we can best serve the populations across the different needs. And then finally, we're really excited to be launching the Aging and Disability Lived Experience Advisory Board to hear directly from these individuals that we need to understand the issues, the concerns, the opportunities to embed the voice of the consumer in everything that we do. This is a key priority elevated by our Equity Advisory. In the area of workforce development, we're really excited to continue our efforts to support California's caregiver, family caregiver population. With the partnership of the UC Davis Family Caregiving Institute, we've developed California's first caregiver equity roadmap. That will be being released this year in the next few months, and then we'll be working to advance that. We're launching a grant for caregiver outreach training and education. We're also working to explore the development of core competencies for direct care workers across all of the different licensure categories that we, whether it be certified nursing assistant, home health aide, personal care aide. How can we make it easier for people to have career development, and either whether it's through career ladders or career lattices? And then finally, as I said, we're really looking to leverage community health workers for the Aging and Disability Network. And then finally, with the issue of LTSS financing and affording aging, we are really excited to show the results of our LTSS financing initiative. Over the past few months, we have worked with ATI Strategies as well as Milliman actuaries to develop a model for a Medicare home and community-based services demonstration. This is like super exciting work that can inform not only our state, but the federal government as well. So we are excited to release that information from that body of work and look for more this spring when we do release that. We're also conducting a number of statewide survey and focus groups of this population of what we call the missing middle, what we're now going to be calling it the overlooked middle, and you'll hear more about that in our initiative, as well as a policy and landscape analysis report that will be delivered in 2026. We're doing some detailed data analytics with Urban Institute and projecting out the needs of older adults and people with disabilities over the next several years, so that we understand population needs now and into the future, and can get a sense of how we might best meet those needs through LTSS financing reform. And then finally, excited to see the Department of Social Services launching the Guaranteed Income Pilot for older adults. So with that, I didn't take too much time. I really want to hear from all of you. I want to thank you for your input. We know that you all have an important role. You push us to do more. Don't be afraid to say what you think. And we look forward to continuing to partner with you on these initiatives. So I'll turn it over to you, Susan.
Sarah, thank you. What a whirlwind, and that's just a snapshot of the highlights. So thank you. Thank you so much. And now the balance of the agenda, we do have time set aside to talk at the end about the LA fires. We did touch on that quite a bit earlier, so I would suggest that we use the balance of our time to reflect on what Sarah just presented and the initiatives before us.
Have Sarita on?
She had to hop off.
Okay, and she's not back. She was landing. Can we just
We could do a
She
quick
is-
double check?
She is not on the line.
Okay.
Sarita is not on the line.
Right, she was gonna kick us off, but.
Okay. Well, it's good you're coordinating. You probably know what she was gonna say. And she was waylaid by fog this morning and rerouted through Fresno. So for those who don't know.
This is Christina. I will just get right into it then. First, I just want to say that as somebody who was a part of the development of the initial master plan for aging, it's amazing to see how far we've come. It's really, really so nice to see that this didn't become something on a shelf that collected dust, that we continue to work on it and are really dedicated to making things happen from the local to the statewide level. And that's really important to me. I also want to say that the report looks like a great way for us to continue to expand aging and disability resource connections. These are all of the things that ADRCs can help make happen. And we at C4A and CFILC are continuing to work to expand ADRCs to really look at goal 3 and working towards expanding ADRCs to be able to do all of the things within the master plan that are possible. In addition to that, I want to just say a couple things about housing, and it's somewhat out of curiosity, but also a little bit out of concern. So just as somebody who's coming back into the mix, I'm probably not going to articulate this in the best way, so just help me in understanding. The report is wonderful, and you touched on some great programs that have really made a significant difference. And I think Heather, Dr. Young alluded to it earlier in terms of tracking and really seeing how we're making a difference over the years is really, really important. So I'm glad the department is going to be working on that. But when it comes to programs like Home Safe, keeping that program intact and moving forward, it's concerning knowing that, that's slated to end. And how are we going to make sure that that stays front and center as we continue to work towards increasing housing and opportunities for folks, especially at the level of success that program has had. Secondly, I would be remiss if I didn't bring up the Community Living Fund. The Community Living Fund has made such an incredible difference, and I was able to talk to some of the organizations that were able to use it to help people, and the amount of work that went into ensuring people had resources and tools to not go into an institution. I think that this is something we actually need to replicate across the country and showcase at some time in the future to ACL about what a small amount of money can do to really make a difference in diversion. And I say that not representing the independent living centers, but knowing that they have an unfunded mandate to do diversion and transition. This is probably one of the first times they've really been able to do it as a result of $10 million. And then third, I'm an avid NPR listener in the morning, and I did catch that the speaker has asked the legislature to focus on housing more than anything, and that they are going to be prioritizing 35 bills, bringing it down from the 50 previously. I would like to see us a little bit more narrowly focused and really looking at housing as one of those areas of focus and how we make that happen through the systems that we're continuing to invest in and increase. Thank you.
I'll jump in real quick following Christina, and again on the topic of housing. I know that there was in previous iterations specific mentions of the shallow rent subsidies that I'm not seeing at this point, and I think that's something really important that we should bring up to the floor again. Again, I know we talked a little bit about the fires earlier, but even before that, I mean that is so important. at AARP, we're hearing from so many of our members and older adults who are, who are still working, they're retired, whatever it is, but they're basically one check away from potentially falling into homelessness. So helping those people who are on the precipice, stay housed, is just crucial, right? Because once someone becomes unhoused, then that opens up a whole host of other issues. And I think helping those who are already homeless and the people who are on the precipice in tandem is really important. So that's something I didn't notice, and I really wanted to bring that up, and make sure that we focus on that moving forward again.
To give you very briefly, in the Area City Council on Homelessness, Dr. Mark Michelle, her ears are ringing right now. I mean, the latest study said exactly what you just said, that if you could, it was one check away, and if there was an ability to prevent that, that makes all the difference. Preventing homelessness. So I just want to note that that is coming up in that platform.
Thank you.
And just, we definitely hear you. And what we're doing and what we've done with the, previously is the Business Consumer Services Housing Agency. They've been amazing partners. But we are going to be, we're looking at all of the different models that are out there at the local level and kind of understanding what progress they've made. And we really, without, there's not a state level, rental subsidy program right now, but we really hope that we can use those promising programs that have been out there to educate the counties on what they can do too. And at the same time, you all will continue pushing for this as well. So appreciate that.
Just want to emphasize what my colleagues are voicing here and the importance of it, and it does additionally tie into the crises and the emergencies that occur around us. I'm looking at the recovery that has happened in our far northern counties, and I think more specifically the lack of recovery, and I'm so glad to hear that there is going to be attention given to that overlooked middle, because I can tell you right now, those are the ones that have fallen into poverty post-disaster. We have property owners, for example, in Butte County, still in the communities of Paradise and Magalia, that 6 years post-fire are sitting on their land unhoused without power because they didn't have the $15,000 required to bring the power from the street 1/4 of a mile into where their new trailer sits. Okay, this is 6 years later. So those are the types of things where, like Christina was voicing, a small amount of dollars could make a huge impact if we understood how to connect the dots. We have, as a Center for Independent Living, been actively engaged with the Community Living Fund. It just made things faster, but I can also say that money went so fast. It doesn't last a quarter. It lasts maybe 2 or 3 months of the year, and then there's a wait list. So we're innovative, and we'd like to bring some of those innovations to the table. We are engaged with CalAIM. It's an arduous process. After a year, we're still working through contracts. But again, we'd rather pave the way. There's not a lot of Centers for Independent Living now jumping over that hoop, and also not a lot of AAAs by comparison to how many AAAs that could be coming forward. Our local AAAs 2 and 3 have basically said to us as the SIL, you guys sort it all out and then we'll follow, because it is such an arduous process. So just some of those things that back up what's being voiced here is that there are small, low-hanging fruits that perhaps we can begin to reach for that could make a huge impact.
Anyone else in the room?
I'll jump in.
Yes, Tiffany.
Tiffany White with SCIU California. Really appreciate being in this space with all of you guys and being a new member to the committee. So just thank you so much for being here. I think one of the things that struck me not only with Sarah, your presentation, but also with Kim McCoy Wade when she was here, when she was talking about making healthcare more affordable, and I would also add on and making it more accessible. And one of the things that we always tend to look at is like that share of cost, and she raised it as well. And so I just want to uplift that as being a priority when we're talking about making sure that folks can have access to stuff and that it's affordable and really getting in there and getting the services and supports that they need. Addressing the share of cost is one way that we can kind of build and have a better foundation to the services and supports programs that are out there, is if we can kind of address what that share of cost is. So just wanted to highlight that. And then when it comes to the workforce, of course, I will address the workforce. Sincerely appreciate the Career Pathways program, and also excited about the Cal Cares. The one thing I would just note is making sure that we have like a permanent infrastructure for training opportunities for the workforce. We saw how great Career Pathways did. Our folks were so excited to take it. They were so extremely sad when it went away, because it definitely made a difference for our providers that, you know, have consumers that have Alzheimer's, and they learn new tricks of the trade and what to do and how to deal with it, and how to better help their loved one, oftentimes because it is a family member, but sometimes it's just their consumer, and they want to be able to better provide services. So just wanted to uplift that, how important training is, how necessary it is, not only for the infrastructure of the various programs like IHSS, but the value that it brings to the caregivers, but more importantly, the value that it brings to the consumers that are really relying on that care from the providers. And then lastly, I think Secretary Johnson, you hit on SNFs. I will just, again, make a uplift for SNFs as part of long-term services and supports. As much as we want to keep folks in the community, there is a need for folks to go into SNFs. And oftentimes, you know, SNFs are getting their money a little bit lagged behind. Their rates aren't posted. They're not getting the funding that they need in a timely way to keep their doors open. And that is problematic when you have shortages for the workforce and you're trying to get folks in so that we can keep the doors open for SNFs. We all know that when there's disasters, we want to keep folks in the community, but sometimes we do have to move them into different settings. And so ensuring that we have the foundation for those settings like SNFs and other facilities where folks kind of go into when there is a need that arises is super important, so that we can have that access to that institutional care, because sometimes, you know, it is what's most appropriate and what is needed, especially in disaster. So really just wanted to uplift those things.
And Linda Way with Western Center on Law and Poverty. If I could just add to Tiffany's first point related to share of cost reform. As a returning member, we were a little disappointed to see it actually fall off as an initiative. As we continue to hear from the community that it is a priority, and had included it in part of the back and forth conversation that we've had. And so we're not just disappointed, but also surprised, particularly with the focus on long-term care. We know how impactful it's not just about being able to afford Medi-Cal services, which opens up access to in-home supportive services. And so not just about affordability, but also access to being able to stay in the community and access those long-term services.
Yeah, I think, well, I have a couple things. First, I think our response to your annual report last time, we included a request for more information on LTSS financing at this meeting, but I do see something's coming up in March or in the spring. So really excited to see what that financing looks like. So we will be patient with that, but you know as well as I do that it's crucially important for the constituency that we're talking about. And I think the other piece I wanted to mention is just the Alzheimer's CalCompass work. Really excited to see that move forward, and hoping that we can assist with any of the recommendations on that. I think that is such a needed overlay for our adult day program. So really appreciate that.
That we will be releasing the kind of guidance that the CalCompass developed, which was excellent. And it's, for those who aren't familiar with it, it's developing, you know, kind of a toolkit for how you develop dementia-capable adult day programming. And you know, that also ties into the gap analysis, because we know that we don't have access to enough adult day programs throughout the state, as well as, and, you know, of course, there's the community-based adult services program, but it all kind of ties together, is making sure that we can provide the right services to people living with Alzheimer's and related.
Heather, have any additional comments? Heather, do you have any additional comments?
No, I don't have additional comments, just appreciation. Thank you so much for the comprehensive presentation, and I'm struck by so much accomplishment and really look forward to moving forward the priorities.
So I'll just echo the comments of my fellow committee members. I'm Yasmin Peled with Justice and Aging. You know, and I have Sarita's comments, so I'll try to weave them in if she's not able to make it here virtually. But, you know, the committee has been pretty steadfast for the last 3 years that the main areas of focus really need to be on housing, on LTSS, and on equity. And we appreciate that those broader themes remain key priorities in the new round of initiatives, or highlighted in the annual report. But I'll just echo the sort of the disappointment that is on housing, that rental subsidies is sort of no longer called out as a specific initiative, recognizing that there are many challenges to getting that started, not only, especially also now given uncertainty at the federal level and what that means for the state budget and all of, you know, we recognize that there are challenges, right? But as Margot Kuchel's report, you know, explains, these rental subsidies are so valuable and so impactful at homelessness prevention. And there are really promising models in San Diego specifically that have been extremely successful. Melinda from Serving Seniors is actually on the Impact Committee, wasn't able to be here today because they're opening a new center, so she had to be there for that. But if she were here, she would tell you all the statistics about how successful their program has been. But they are running out of money. And in order to keep something like that going, they're really looking for a sort of a statewide program to be able to plug into. And so that remains a priority for this committee to keep sort of pushing for, and because we know that that is what a lot of folks need. As a part of the broader work on housing rental subsidies are extremely important. And then on LTSS, one of the key recommendations that the committee has had on LTSS is the implementation of the share of cost reform. And like Linda mentioned, that was previously an initiative standalone in the prior initiatives, and that is no longer there. Recognize again, there are budgetary constraints, but again, we see that as being one of the first steps to really starting to make LTSS more accessible and affordable to people in the state. You've all identified in the annual report that the key challenge under Goal 2 is that people on Medicare can't afford LTSS. And we see share of cost reform as being the gateway to changing that. Because right now, if you're just $1 over the income limit, if you're on Medicare and you're just $1 over the income limit for Medi-Cal, you have to spend down all of your income on healthcare services, and you're left to live on $600 a month, which is not possible. And then also antithetical to the MPA's goal of affording aging, and antithetical to the goal of health reimagined. So it's sort of, we see share of cost reform as being a really critical piece to unlocking both the healthcare piece and the affordability piece. And I know Kim, before she left, touched on affordability as being sort of a key piece of this as well. And I think sort of taking us also back to the fires a little bit, that the fires compound the key issues of housing and LTSS that the committee has been focused on, right? If you've lost your housing, this is only going to increase housing instability and insecurity, especially for older adults, older renters, people who were lower income. Even in the Palisades, there was a mobile home park that no longer exists, had many low-income residents, older residents. So we're not just talking, we're talking about this as being sort of systemic, an issue across both fires. And if you've lost your home, what happens if you need in-home support. What happens if your caregiver lost their home and maybe you still have your home, but now your caregiver doesn't have a home, or how are you getting those caregiving supports? And how are we, I personally know that in the stories and the GoFundMes that have been, you see stories of people, the ones that have sort of hit closest to home for me are the people that were taking care of their parent that had dementia and they've now lost their home. And so you've got a family caregiver that's lost their home, you have a aging family member with dementia or Alzheimer's. Where are they, maybe they have family in LA that they can go to, but how do we know that that person is not having to end up in a facility? And how are we tracking whether or not that person is able to re-enter the facility, right? Maybe they temporarily need to be, get that support in an assisted living facility or a skilled nursing facility. But the fire shouldn't, and the recovery process shouldn't mean that they get stuck there if that's not where they want to be. If people want to be remaining in the community, what are we doing to ensure that that is a priority in the recovery process? And look at Sarita's. Oh, she's joined. Okay, Sarita, you can have the word.
I am so sorry. Yes, I made it, and thank you so much. Yasmin, I don't know what you conveyed, but I will just reiterate probably some of the things you said, which are, I think, first and foremost, I've been on this impact committee since the inception, and I just really want to truly recognize the California Department of Aging's leadership in spearheading this all of government approach. Really been critical to just really addressing these silos and advancing progress. So I've really been thrilled to be on this committee. I think it's, just with I'm sure this has been said, but with the uncertainty, all the things that are going on as we're facing this new administration, I think it's even more critical than ever to protect against the progress that we've made thus far. So, having the resolve, making sure we continue, really critical. And what I think, we've heard is we're excited to see some of the new initiatives. But many initiatives, I think one of the feedback that I will convey just over the time is that they still tend to be broad without clear measures of success. So, and we know what's been the impact committee since when I was on and continued to be on with the other individuals. We elevated two key areas of focus, the home care system that works for all of Californians and preventing and ending older adult homelessness in California. I know these issues are a big lift, but really critical. And the committee remains concerned. I think you may have heard this, that and even today, that incremental solutions such as rental subsidies and addressing the Medi-Cal share of costs really previously prioritized in the MPA are not included. So those are some of the things that I think, while we such changes have cost barriers in the short term, a clear vision and continued commitment is really imperative to drive us forward. So, I mean, at the end of the day, I think I'm looking forward to the continued partnership with CDA. I think we've made some progress. We've seen things like over 364,000 older adults accessing healthcare coverage due to the Medi-Cal expansion and things like that. But I would say that we just need to continue with resolve, research studies, and the progress driven by the MPA towards action on these critical priorities. So I would love to continue that dialogue about with this committee to make sure that we drive those initiatives forward. So I'll pause and see if there are any other questions and comments.
The only other thing I'll add is that, we all as a committee really look forward to being able to work with you all in between the sort of these formal quarterly meetings and trying to find ways that we can sort of collaborate more informally and sort of be thought partners with you as you're working on the very big plate of work that you all have. We want to be helpful to you all and not just sort of coming to you in these formal settings and not being able, and we just want to work with you closely through the implementation process. And that goes with also working with the other subcommittees, right? So working to figure out ways together how we can have more collaboration and coordination with some of the other subcommittees we all have the same ultimate goals, right? But we all come at it from different angles and with different expertise. So we want to continue to sort of work with you all to figure out how all the subcommittees can be working together.
So much, and everything stated here is validated by our other stakeholder committees. So it is heartening to see everyone rowing in the same direction. When I think back to planning this agenda, we originally thought we'd be talking about the state budget. That's hardly even come today. The January 10th budget is just, didn't dominate the conversation today. So we have the right impact committee. We have heard from every one of you today. Thank you for being such active participants in today's meeting. We've taken notes. All of the notes will be shared out. We didn't thank our other department directors and staff, our other agencies. They were as excited as you were to see the annual report and the initiatives go live this week. They're very invested in this work across state, and even our constitutional officers and their staff are invested in this work. So we'll be sharing out to all of them your comments. Secretary, thank you for joining for the entire time. I'd like to give the balance of time to you, for any closing thoughts that you have, and then open it to public comment.
No, I echo, pile on the right group. Really appreciate your thoughtfulness. Continuing to ensure that we have the right strategies moving forward, and also where you feel like, don't forget, I heard that clearly, of these other components, and I think that's right. We always have to be clear on our priorities, appreciate through your last comment on, and also being able to demonstrate success, but also make sure we're always keeping in mind and kind of teeing up the next things that we're going for, taking every moment we can, every opportunity we have to be able to effectuate some of the things that you put forward to get together today. So I just really great welcome again. I didn't say that. Welcome new members to this group. Thank you for those who are continuing in this space, and just appreciate that we have tables set to continue these dialogues, and to your point, that we are doing the in-between work to make sure that the momentum stays strong. So just appreciate you all. Okay.
Thank you. And if I might just add one comment before we move to public comment related to the wildfires. This is Linda Way with Western Center on Law and Poverty. Appreciate all the work, the swift action that the department has done, but recognizing as secretary, you work across different issue areas. Just wanted to share a thought that we've been thinking about. Again, appreciate all the swift action that has happened, and when we think about recovery, and something you mentioned related to system changes, knowing that sometimes our systems are not as nimble, and so have appreciated the Department of Healthcare Services, Department of Social Services, action on ensuring that people are able to if they're not able to access their mail, other documents, that if they contact the county, they can get their Medi-Cal is not terminated, their IHSS, their CalWorks, CalFresh, but that in some cases that requires actually contacting the county, which can be a challenge considering all that, and so preparing for the future, thinking about if there are ways, and making sure we have all the tools in the toolbox to actually think ahead, because unfortunately this won't be our last natural disaster of being pausing, having systems ready that if this were to happen again, that we can just with a flick of a button say, let's pause these negative actions so that it is more systemic versus having to contact the county and all of that.
We aspire for the no wrong door system, and having spent time in the recovery centers, I mean, it is there, people having their driver's licenses printed out in person, their vital records, it is a one-stop shop of every health, every just incredible response at the local level, city, county, state personnel, all physically present, 9 to 9 every day, in real time, and that's for those who make it into the recovery center. But for that comment, sure. So now, Carol, can we will you be leading us through the public comment?
I will. Can we put up the public comment slide? Okay. Let me highlight myself. Okay, we do have a couple hands. So I will call on Jennifer James. You are unmuted. You have 2 minutes for your public comment. So if you can go ahead, you can unmute yourself. Hopefully. Jennifer, can you unmute yourself? Let's try to go to Tatiana and see if we can get her going. Tatiana, you have 2 minutes. Can you unmute yourself?
Yes, can you hear me?
You can, thank you.
Okay, wonderful. Thank you so much. I'm Tatiana Fassier with California Health Advocates, and I really enjoyed being part of this conversation. Some of the areas that you have touched on are particularly touching for me because I'm also a caregiver for my 99-year-old mom that now has to live in a nursing home. However, the desperate messages and calls that we get through our own website dealing with family caregiving issues, not knowing who to go to, the treasure that HICAP in every county can help with reference to access to health benefits and how to resolve certain issues. And in particular, I have to repeat, the share of cost issue has been brought up again, and there are ways currently for people to either reduce or eliminate that share of cost if they're Medi-Medi, if they've got Medicare and Medi-Cal with a share of cost. The fact that they can purchase, there is a guarantee right in California to buy a Medicare supplement for a premium that could reduce or eliminate that share of cost is a little known fact. So I want to make sure that everybody understands the treasure that the local HICAP is there, and we and I train and support the local HICAPs with reference to Medicare. I appreciate everybody's work, and I look forward to continuing being part of this this endeavor. Thank you.
Thank you, Tatiana. I'm going to move to Jennifer. Let's see if we can unmute you again. Can you go ahead, Jennifer?
Hello, can you hear me?
Can now. Yes, please go ahead.
I am so sorry. I am using a shared link, and my name is actually Maxwell Davis.
Hello,
I apologize.
Maxwell.
I didn't realize you were asking for me.
Oh.
Hi. I am the Director of Workforce Development at the School of Social Work at San Jose State University. I'm also the PI and Director of the Adult Protective Services MSW training program that was previously carried out both in pilot and statewide versions through UC Berkeley at the California Social Work Education Center, and which was moved to our new center at San Jose State this past fall. I am, of course, an enormous fan of the Master Plan for Aging, and I think it's wonderful. But I was very disappointed to not hear the MSW training program mentioned in the workforce development section of the report. And it appears that somehow we have fallen off the radar because we also have not been allocated funding for the upcoming budget year, even though we actually had anticipated, based on our previous discussions with CDSS and other entities, that we would be entering a new 3-year contract on July 1st for the training program. At this moment, CDSS has about $1.4 million in scraps left over to offer us for next year, which is not adequate. We operate the program on about $3 million per year minimum. So the very real possibility exists that this so far extremely successful training project is going to end as of June 30th, unless we can scare up at least another probably 1.2 million in state funding for the upcoming budget year. And I just want to make sure that people are aware of that because, again, we seem to have fallen off the radar. Thank you so much for your time.
Thank you very much for your comment. I will move to Karen. I'm unmuting your line. You are indicated as Karen. Hopefully you can unmute your line now.
Yes, this is Karen French. I'm a Santa Rosa, Sonoma County resident, and I'm also a delegate for through CARA for the California North Bay Labor Council. My question is that affordable housing is determined by the state, and we want to know affordable for who. The developers say that they have affordable housing available based upon the state standards, but in reality, low to moderate income residents cannot afford it. Seniors obviously cannot afford it based on their retirement income. This income threshold is not controlled by the county or the city, according to the mayor. He said that the developers apply for new building permits with the state. They submit a percentage that will be affordable housing. Unfortunately, the state median for determining the income level that qualifies as affordable housing in California is way above the amount that low-income residents in my area can afford. How can you get the state to modify the thresholds so new housing is affordable for people in an area based upon the median income of that area?
Karen, thank you for your question. We are not taking and responding to questions at the time, but we have transcribed your question and we will take it back.
Oh, all right.
Thank you. All right. Any other questions, any other comments for public comment? We would like to remind you that at any time you can send your comment to engage at engage@aging.ca.gov. Or we would be happy to respond via email. Anyone else? We will take it. Your comment now? If not, I think I will turn it back over to our Director DeMorris to close us out.
Thank you so much, Carol. Thank you to all of our public members who joined and made comments. Thank you to our members who joined us today, to our staff, especially to Kim McCoy-Wade and Secretary Johnson for joining us. I'm going to end on a positive note. As Yasmin noted, one of our members is not with us today, Melinda, a new member of this committee who is the incoming CEO of Serving Seniors in San Diego County. Today, they are opening a 79-unit affordable housing complex for people 62 and older that includes a 3,000 square foot community room. And that is why she's not with us, and that's a very good excuse. So any of you that want to open affordable housing and have permission to
Okay.
but it is, the progress is happening, sometimes slowly, sometimes quickly. And thank you for being with us through it all. And we look forward to working with you in between meetings and to our next meeting in the spring. Thank you all.
Thank you.
Thank you for joining us.